Now we're just going to turn to the front side, which is going to show us our back side. And this patient, she comes in and wanted to do flank, called lower back, and sacrum resection, which is a very, very beautiful resection. One of my favorite things to do in the office because it gives a female her feminine torso and her feminine silhouette, because what happens when we resect it is you'll see a very beautiful S-curve come in and then come back out as you see more of her gluteus maximus, more of her beautiful outline as a result of this resection. So simply what I do to kind of denote the area, I just kind of pull up on this tissue here and I note the actual area where the patient's going to have a natural curve. You can kind of see it right there. And the next thing I do is I then just simply move up on her buttocks, and you can actually see an outline of her upper glute in this area. Really simply move that up. It helps me outline this area very nicely. And the last thing I do is I demarcate her sacrum, which is a beautiful area in females to actually resect whenever we're doing a lower back. So you can see, so when we do the flanks, my favorite thing to do is to resect this entire area here. And in this situation, I would resect these areas of intensity here and on this side as well. So by simply coming in here and resecting the fat, you're going to see a much more beautiful feminine curve, and then her buttocks or her glutes will actually, what I call it, we call it, is popping out more. It'll actually bring out her buttocks more, give her the illusion that she's had a butt lift, but she's actually not had a butt lift, just by taking and resecting the fat in this region. And usually when a patient does the flanks, I'll also include the love handle on this side as well, because it just makes sense to go on ahead and resect this area too, so that you can have that very tiny, tiny waist that's produced after the resection, and then you have a beautiful feminine curve, and then you have that really nice dug in sacrum that works right after the procedure.